Bienvenidos a todos,
Okay,
feliz de
team.
poder estar
Welcome,
compartiendo con
everybody. I'm
ustedes
so
en
happy
esta
to be
semana
able to be sharing here
y
with you this
haciendo
week
todo lo que
and to
amamos
be
y nos
able to do
encanta. Varias
everything that
cositas
we
antes de empezar.
love.
Hoy
A
es una
few
clase
things before we
muy,
begin.
muy importante
Today, I have a
y una clase
very,
que me
very
encanta
important
y sé que le
class
vamos a
and a
sacar
class that
mucho
I love,
provecho.
and I know that we're
Tenemos
going
una
to make
excelente
a
profesional con
lot
nosotros,
of. We have an
pero
excellent
sobre todas
professional
las
with us.
cosas,
And above
antes de
all,
darle paso a ella, ¿verdad? Nuestra
before
invitada,
we
lo
speak
que
with our
quiero es
guest,
que
what I want to do
hablarles de algunas
is I
cositas.
want to
Uno,
talk to you about a couple of
hoy
things.
a
Number
las
one,
7 de la
today at
noche, hora
7
Miami, es decir,
p.m.
terminando
Miami
acá,
time, so
tenemos
finishing here,
una llamada que
we
todos,
have a
todos,
call
todos
that
deben estar,
everybody,
toda nuestra
everybody,
organización,
everybody should listen to,
porque
our
vamos a
whole
estar dejando
organization,
saber cuál es el próximo
because we're going
destino.
to
Se
let you
saben que
know
hoy
what the
estuvimos en
next
Destin y
destination
hay otro
is.
destino
Remember,
y
we were
otro
in
viaje que
Destin,
viene con esa gran
and there's another
experiencia
trip with that
que
amazing
tuvimos y la
experience
llamada
that we
es hoy.
had. And
La
the call
pusimos
is
temprano en la
today.
mañana, se van a
We
enterar de todos los
shared it this
detalles. So,
morning,
hoy
early in the
terminando
morning, and you'll
nosotros,
know about
nos
all the
vamos allá,
details. So
el
today,
enlace se
once
compartió
we
el canal de
finish, we're
información
going to
para
share the
todos
link on
ustedes
the
y que puedan
information channel
entrar.
for
Dos,
all of
otra
you to
cosa,
be able to
el
log in.
evento del
Another
31
thing,
de
the event
mayo.
on
Mucha
May
gente me ha
31st.
preguntado,
Many people have come
hey,
up to
eso
me
es
and
para
asked
todo
me,
el
hey,
equipo,
is
veo
that
que
for the
es
whole
Wellness
team?
Revolution.
I see that it's a wellness
Gente, aquí no hay
revolution.
división,
Guys, there is no
recuerden, por
division
favor,
amongst
lo
us, okay?
hablamos, eso es para
Remember, we spoke
todos.
about this.
Ese día
This is for
te mandas
everyone.
a hacer tu
That
camiseta de
day,
Wellness
just
Revolution, que también está
order
el
your
canal de
Wellness Revolution
información,
t-shirt
pusimos
that will
el número
also
de
share
teléfono
in the
y
information channel,
todos
the phone
vamos
number
para
for
allá
that.
porque es un
And we're all going
movimiento lo que
over
se
there
está
because this is
creando.
a
Entonces,
movement what we are
no
creating.
sientas que esto no es para ti.
So don't
Claro que es
think that this
para
is not
todos,
for you.
todos. Si tú
Of
estás en
course, this is for
LifeWave,
you, for
este
everyone.
evento es
If you're
para
in
ti.
LifeWave, this
Entonces,
event is for you.
recuerden, no pongamos
So
en nuestra mente esas
remember, let's
divisiones.
not put any
31 de mayo
divisions
hay
in
un
our head.
bootcamp en
May
la ciudad de
31st, there's a
Miami y
boot
están
camp in
todos
Miami City,
invitados.
and
¿Cuál es la
everybody
idea?
is
Tener una
invited. What
experiencia
is
y
the
que ustedes
idea? The
inviten a
idea is that we're
personas,
going to
¿ok?
live an experience and we're
Tercero,
going to invite people.
mañana hay algo
Thirdly, tomorrow
importante
there
que
is
les estaba
something
contando. Vamos a
important
estar
that is going to
compartiendo con
happen.
ustedes
We're going to
un
be sharing
recurso
with
que
you
va a
a
llevar el negocio de
resource
ustedes
that
al
is
próximo
going to
nivel.
take
Entonces les
your
pido que
business
por
to the
favor
next
estén
level.
muy,
So
muy
please, I want
atentos
you to pay
a que
a
se va
lot
a
of attention
compartir un
to
videito
what
después
we're
que
going to
terminemos hoy
share, the video
para que
after we
ustedes sepan
finish
de esta
today,
reunión que hay
for you to
mañana.
know
Es
about
un
the meeting that we have
lanzamiento de un
tomorrow.
recurso
It
que cada
is a
uno de ustedes
launch
va a
of a
poder usar
resource that
para
each and
llevar
every
su
one of you
negocio
is going to
a
be
un
able to
próximo
use to
nivel.
take your business
Ahora
to the
sí,
next
no
level.
demoro más.
Okay, I'm not
No
going to
demoro
take
más y
longer
vamos a
now. I'm
quedarle
not
que
going
me
to take
encanta.
longer, and let's
Otra
go to this
cosa, si
dance because
ustedes
I love
son
it.
de parte del
Another
equipo
thing,
Be the
if
Light
you
de
are
nosotros,
in the Be the
este
Light
diseño que
team and
ustedes
our
ven lo
team,
tenemos
this
a
design that
disposición.
you
Hoy
see
estaba conversando con el
is
equipo, les mandé un
available.
videito.
I was talking to the
Sería genial
team.
si también
I
ustedes lo
sent a
ponen
video,
y todos nosotros, porque como
and
digo, nos representa
as
y los
soon
valores
as you have
fundamentales
it, use it because this
del equipo
represents our
específicamente, aunque de nuevo,
core
cada uno
values
tiene
of our
nombre
team.
como quiera,
But of
mientras
course,
nos
everybody can
identificamos
have their
todos en familia
own
y
name,
el único
whatever
que
they
manda
want. We're
siempre
all a
yo, ¿ok?
family, and the only one
Entonces,
who
les
is
cuento un
boss here
poquito de
is
nuestra
God,
invitada, me
always. So
encanta,
let me talk to you a bit
porque
about
es
our
una
guest.
gran
I love her because
especialista.
she is an amazing
Gente, miren cómo me
specialist.
pasó. Ella está
People,
en
look at
nuestro
what
equipo.
happened to me. She
Realmente
is in
está
our
en
team.
el equipo de
She
U90X,
is
que
in
somos
the
iguales, o sea,
U90X
estamos
team.
juntos todos, pero
We're
bueno,
all
ellos se
together.
identifican de esa manera.
But anyway, they
Y
identify
yo
each
siempre estoy
other like
revisando
that.
entrenamientos y
And I'm
yo la
always checking
conozco,
out
he
the
hablado
trainings
con
and
ella,
everything. I know who
pero no
she is.
había
I've
dado
spoken to
entrenamiento.
her.
Y yo mientras
But
estaba entrenando,
while I was
lo
training
yo
my
digo, oh
team,
my God, ese
I was
entrenamiento
looking at her and I
tenemos
was
que
like,
hacerlo de
wow,
nuevo y
her
tenemos que
training is
llevarlo a
amazing.
más
We have to do
personas.
this again and
Y
we
estoy
have to bring
hablando
it
de
to
la
more
doctora
people.
Jimena
And I'm talking
Cuevas
about
y
Dr.
me
Jimena Cuevas.
encantó como ella
And I
explica, una gran
love the way that she
especialista,
explains. She's an
doctora,
amazing
especialista en
specialist. She's a doctor,
nutrición, medicina
specialist in
estética,
nutrition, aesthetic
antienvejecimiento, salud
medication,
funcional. Es decir, ¿qué
anti-aging,
crédito no
functional health.
tiene mi
So she
querida
has a
la
lot
doctora
of
Jimena?
credits, my
Entonces la
dear Dr.
llamé, yo le
Jimena.
escribí y le dije,
So
Jimena, me
I called
encantaría
her, I wrote her a
que
message, and I
pudieras
said,
darnos un
Jimena, I would
entrenamiento
love it if you
así como
could
lo hiciste,
train
porque ella va
just
por
like you did
cada
with your
parte,
team because
cómo
she talks
recomendarlo,
about each
todo, todo
patch,
tan
how to
perfecto.
recommend
Y
it,
dije, quiero
everything,
traerte
everything
para que
perfectly.
también lo
So I
hagas. A
told
lo
her, I
mejor a
want you
todos
to
los que
be
me
here
escribieron en
and
eso,
show
yo lo vi
everybody
en YouTube y la
in
verdad,
our
yo no me enteré
team.
del
I saw it in
entrenamiento.
YouTube
Y dije, ¿por qué no te
actually,
traemos una
and I thought, why don't we bring you over and more people can hear you? Because each time that we hear people like this, that we can learn from them who are specialists, we need to go listen. And just like a sponge, we need to absorb. So please have your book in front of you, your notebook. Remember that the recording will be in YouTube, like all our recordings. So, dear Jimena, first of all, thank you. Thank you for saying yes and for being here with us, sharing. You have the floor completely to you. I'm going to shut up and I'm going to start writing notes too. Hi, hello, my friend. Good evening, good evening. Well, first of all, I feel very happy to be here with the whole team of Be the Light. For me, it is truly an honor to be with all of you. And what I do want to ask you for a favor, I'm going to go directly to the point because just like Rochelle said, it's a lot of information and I'm going to share it the easiest way possible so you can get to know all the patches that we have and you can use them in an effective way, but in a super easy way because I see or many times I get private messages, DMs saying that they're confused, they don't know what to use. So today, call is going to give you a lot of clarity. And please, two favors. Number one, get away from anything that might distract you. If you're looking at WhatsApp, Facebook, TikTok, whatever, please turn off your cell phone for a second. Or if your kids are playing around, let them play and focus on this next hour. And the second favor I wanted to ask you is that I hope that you have your notebook and your pen ready because truthfully, there's going to be a lot of information. You will be able to see the recording again, but remember that this is the only opportunity to ask your questions or any doubts that you have at the end. So I'm going to share the screen. Okay, perfect. Okay, here you can see the full screen, right? Okay, wonderful. This is a phrase which I love that says, "This little patch could change your life." And I say this to my patients every day. I'm recommending my patches. Listen, ladies, gentlemen, I'm a doctor and I prescribe medication. I don't prescribe patches, okay? I recommend patches, just like all of you. Because, first of all, it's not a medication. We already know that, all of us. It's a completely natural technology that we're going to talk about. And number two, you don't need to be a doctor. Oh, I'm sorry for interrupting you, but you can see that you're sharing your screen. It's not completely on the screen, it's divided, just so you know.
Ahora sí. Gracias, mi
Okay,
amor. Perdón la
perfect. There you
interrupción.
go. Sorry for interrupting, darling. Can you see it big? Yes. In the full screen? Okay, yes, perfect. Just like I was saying, this is not a medication, so you don't need to be a doctor to be able to recommend these patches. But the better you learn of all the benefits, the action mechanism, how they work, and everything else, obviously this is going to make your business much more flow flowing much easier, sorry, and you're going to be able to help your prospects better. So let's start with the people who have been here for over a month. You probably already know this, but if you're completely new, if you started the day before yesterday or yesterday and you're just learning about this technology, we already know that LifeWave is a biotechnology company. And something that I love as a doctor, and you probably love too, is that this is a unique technology. We have all the patents of all the patches, and that means that we have absolutely no competition. So it is the only patch that works with phototherapy. Remember that we have a lot of patches in the markets and in the pharmacies. The nicotine pack, the patch for ibuprofen, the contraceptive patch. Those are patches that are liberating medication, drugs, substances to the blood flow. Our patch is completely different to that because it not releasing anything into an organism. That means it's not transdermic. When our presentations we say that the therapy is not transdermic, many people ask me, what's that? It means that it doesn't contain any drug, chemical, toxin that enters the body. It also doesn't contain any stimulants. Okay? And something that I love about this is that these are activating patches. All these patches activate. It means that it activates different mechanisms depending on the patch. Oh, one moment, please. No, darling, I can't do that. Go with your dad. Oh, sorry about that. So all our patches activate something. There is only one patch that blocks, which is ice wave. It's the only one that blocks, and I'll explain what it means by blocking. But all the rest have activation patches, are activation patches. There's no absolutely any second adverse effects. None of our patches have adverse effects. Don't be afraid. Don't think, oh, if I recommend this patch, it might affect this person and this. No, there is true that there is
posible o no hay ninguna probabilidad de que alguien le vaya a hacer daño el parche, ¿ok?
contraindications, but
¿Y cuál
it's
es la
impossible
diferencia
that this
entre los
patch
10 parches
is
que
going to hurt
teníamos y
anyone. And what
todos
is
los
the difference
parece,
between
¿no?
the 10
Ustedes van
patches
a
that
ver
we have? They all look
que
alike,
yo cuando
right?
me los quito,
You're
de
going to
repente
see
ya
that
no
when
tengo
I
la luz
take them
padre.
off, suddenly
De
I don't
repente
know
le quiero
which
quitar
patch I
el
had
brillo,
on.
fíjale cuál es este,
Sometimes I
pero
want to
esta
patch my
no.
son and I was like,
Son
which one was the
exactamente iguales.
X39? I don't know
Ambos
because they all look
clarito,
exactly the
pero
same
son totalmente
at
diferentes
sight,
al
but they are totally
microscopio, porque
different
acuérdense que están hechos de
under the
nanocristales.
microscope because remember they're
Entonces,
made
la
out of
diferencia entre cada
nanocrystals.
parche es,
So the
digamos,
difference
la
between each patch
acomodación
is
de los
how those
nanocristales.
nanocrystals
Entonces,
are
cada
placed.
parche tiene diferente,
So each
como
patch
podríamos decirlo,
has a different, how could you say
como, o
that,
sea, la frecuencia o la luz que van a
frequency
reflejar va a ser diferente
or
en
the
cada
light
parche. Como
is
imagínense
going
una
to be
prisma, ustedes
different in the
conocen los
position
prismas,
of
¿no? Que de
each
repente le
patch.
pones la luz de un
You know
lado
what a
y
prisma
emite
is?
o saca un color rojo.
Imagine a
Le cambias la
prism
luz más abajito
that
y
depending on the
entonces
light,
te
that
da un
prism
color
might
verde.
give you a
Y
color
le
red,
cambias la luz
or
a
if you change the
a
light a bit more, it
localización y
gives
te
you
da
a
un color
color green, or if
azul.
you
Cuenta que
change it
aquí
to
el
another
parche es todos los
place, it gives you a
nanocristales están
color blue.
acomodados de manera
That is
estratégica
exactly how the
para que la
patches
frecuencia de luz que
are
emitan
located
tenga una
and
activación en nuestro
positioned in a
cuerpo. Entonces vamos a
strategic
empezar con uno
way
de
for
estos
them
parches
to
muy
have an
rápido.
activation in
Y
our
quiero que les
organism.
quede claro,
So let's
chicos, que
start with
aunque
one of the
tenemos muchos
patches, and I
parches
want
y
you to
todo es
have
una
this clear,
maravilla, ya
guys. We
están
have a lot of
disponibles,
patches.
ya
They are all
hay
amazing.
todos,
I have
menos
practically
uno.
tried them
Ahorita les voy a
all
decir cuáles
already,
son los que no he
except for
probado,
one.
todos
I'll
los
let you
demás
know
ya los he
which one I
probado.
haven't tried.
Pero el
I
más,
have
más
tried all the
importante
rest,
es este,
but the
el
most important
X39.
one is this one,
Quiero que todos
X39.
se vuelvan
I want
expertos
you
en el
to all become
X39. Y
experts
cuando
on
no
X39.
sepan qué
And when you
recomendarle a
don't
sus
know what
clientes
to
y no les
recommend
conteste la
your
doctora Jimena
clients,
y no les
and Dr.
conteste la
Jimena doesn't
gerente,
answer, and
no les
Rochelle doesn't
conteste su
answer,
upline y digan, ay,
and your
claro,
upline doesn't answer, you're like,
denles el
hey, what should I do?
X39. No hay
Just give
manera
them
de
the
que se
X39.
equivoquen.
There is
¿Para quién es
no
el
way
X39?
for
Para
you to
todos,
make a mistake. For
excepto
who is the
personas con
X39?
cáncer.
For everyone except for
Quimioterapia
people with
y
cancer that are
personas que
going through
tengan transplante
chemotherapy
de
actively, and keep
órganos
people who are
que
going,
estén tomando
who have had an
inmunosupresores.
organ
Son las dos
transplant, who
únicas
are
contraindicaciones. De
taking
ahí en fuera, a
immune
todos. ¿Y
suppressors.
qué es lo que hace el parche
Out of that,
X39?
anyone can
Esto
use them.
también,
What
si
does
ya llevan más
X39
de
patch
un mes, esto
actually
ya lo
do? For
sabemos y
whoever
somos
has been
memoria.
here for over a
Lo
month,
que
we
hace
already
es
know this.
activar
But
el
what it
péptido
does is that it activates a
GHK,
copper
que está
peptide,
formado, es un tripéptido,
GHK,
o sea, son tres
which is a
péptidos o
three
tres
peptide.
proteínas, que
It's
es
like three
glicina, histidina
proteins,
y
which are
glicina.
glycina,
Estos tres
posterina,
péptidos
and
hacen el
glycyrina.
péptido de cobre GHK y
Glycine,
su función
peptine,
principal es
and
activar
glycyrine. And
o
what they
nutrir a
do
nuestras células
mainly
madre,
is to
pero también esa
activate
palabra me
and
encanta, células madre
enrich our stem cells. Now,
pluripotenciales.
this is a word that I
Esto es
love.
bien, bien importante
Pluripotential
porque
stem cells, okay?
eh,
That's very
yo
important for
comparo
you to know.
mucho nuestra
Why? Because I
tecnología de
compare
parches
very much
X39 con las
our
inyecciones que algunos
X39
colegas míos
patch technology
aplican.
with the
O sea,
injection that
el
some of
tratamiento de
my
células madre ya es
doctor
muy
colleagues apply.
antiguo, ya
Stem
lleva
cell
muchísimos
treatment
años
is
haciéndose,
something that
pero
has
lo
been done for
hacíamos
many years, and
con la ayuda de
but we
inyecciones.
used to do that with
Estas células
injections.
madre se
Now,
inyectaban,
these
pero
stem
eran células
cells
madre o
that
de
were injected
otro, de una
came
placenta o de un
from
cordón
a
umbilical,
placenta
o
or an
salen células
umbilical
madre de una
cord,
persona,
or
de
they
otros
were
ser vivos
somebody else's
animales.
stem cells or another
Entonces,
living being
realmente
like
no
animals.
sabíamos cómo iban
So
a reaccionar
truthfully, we
esas
didn't
células
know
madre
how those
ajenas
stem
a
cells
tu cuerpo.
from others,
Pero con este
other living
parche
beings were
estás
going to
activando
react in your
tus
body. But with
propias
this patch,
células
you
madre
are
y
reactivating
ya
your
el hecho
own
de saber que
stem
son
cells. And now the
pluripotenciales
fact that you know
significa
that
que
they are
son células madre
pluripotential stem
que van
cells,
a
it means that those
diferenciar
stem cells are
lo que
going
tu
to
cuerpo
differentiate
necesita.
with
O
what
sea
your
que a mí
body
mi parche
actually
me
needs.
sirve diferente que a
So the
Raquel,
patch is different
diferente que a
in me
Karen,
than in
diferente que a
Rachel, and
Rosy,
different
diferente que
in
a
Karen, and
Mariantín,
different
o
in
sea, a
Rosie,
todos
and different in
tenemos un
Mariantin.
efecto
So we all
diferente
have a
porque cada
different
ser humano,
effect
cada cuerpo
because
tenemos
each human
nuestras
being,
necesidades,
each
nuestros
body
daños
has their own
cerebrales, nuestro
needs,
diferente estrés oxidativo.
and
Entonces, estas células madre que todos los días estamos activando con el
every
parche
day we are
X39
activating
van a
them with the
diferenciarse en lo que
X39
tu
patch,
cuerpo
which are going
necesita.
to create a
¿Ok?
difference with what your body
Ahora,
needs.
¿qué es lo que van a hacer? También el
So
péptido de
what
cobre
is
también
it
lo que hace
that the
es la
copper peptide
reparación
is
de
going to do? It also
tejidos,
repairs and
órganos internos,
regenerates
cerebro,
the
corazón,
tissues, the
páncreas,
internal
pulmones,
organ, the brain,
músculo,
the heart, the
hueso, o sea,
pancreas,
cualquier tejido se
the
empieza a
lungs, the
reparar y a
muscles, the
regenerar
bones.
porque el
Any
péptido de
tissue
cobre
starts
también
to repair and
estimula nuestro
regenerate because the
colágeno
copper
y
peptide
nuestra
also
elastina. No sé
stimulates
cuántos
our
de ustedes
collagen
fueron
and
algún
our
día a
elastin.
Especialidad de los
I don't know how
Exteriores
many of
y
you
ven
have been
unos
using
bustos como
X39
la
for
célula
over for 1 month, and how you see how your skin is becoming more youthful, how your white hairs start disappearing, right? Because the cells and the body starts to rejuvenate
También ayuda
from
a reactivar
inside
los
to outside.
neuroquímicos y
It
bueno, te digo
also
que es muy
helps to
importante porque todo el mundo
reactivate
ya sabe que estamos hechos
the
de genes. Traemos los genes de
genes,
mamá
and
y de
that's very
papá,
important because
pero
everybody
también de los
knows
abuelos,
that we're made of
bisabuelos,
genes. We have
tatarabuelos
mom and
y de
dad's genes,
toda
but
la
also
generación hacia arriba.
the grandparents, and all the generations upwards. So we have healthy genes and we also have illness genes. Obviously, this depends very much on our everyday habits. What do we choose to eat, if we're doing exercise or not, if I take supplements, if I meditate, if I pray. It depends on how I live day after day, which are the genes that I'm going to wake up. That's why I do recommend that apart from using our amazing patches, for you to try to have a healthy lifestyle, as healthy as possible, so you can wake up all your healthy genes. And with the help of the patch X39, we are turning off the illness genes. Because if you have diabetes or hypertension genes or cancer or whatever, use X39, you are reducing the risk of having that illness. It also reduces oxidative stress and inflammation, which are the illness that we all have nowadays. We all have oxidation from stress and inflammation because we eat a lot of sugar. Well, I don't, but people eat a lot of sugar. People are very stressed and they don't know how to drain that stress. People are sedentary. People smoke, they drink a lot of alcohol, and that's why cells become oxidated and inflamed. And that is where premature aging comes and illness. So X39 is going to reverse that inflammatory oxidation and the inflammation to protect our DNA. So it is a super preventive heal, sorry, a super preventive shield that you have to use. And if you're going through a health issue, whatever it is, if you're not going through chemotherapy or you don't have an organ transplant, you must use it to repair whatever's damaged in your body. Okay? So then when customers ask, but what benefits does the patch actually have? These are the 10 main benefits, but truthfully, there are many other benefits. The first thing that you realize when people put it on for the first time is a reduction or elimination in pain, chronic pain or acute pain. So if I just hit my finger against something and I use X39, probably my pain will go away. But if I already have fibromyalgia, arthritis, or any other pain since a long time ago, it's also very probably that that pain will be reduced or even disappear. It also accelerates recovery when you have an injury. For example, after a surgery, if I just had a surgery, it helps the wound to heal faster. I have a friend from our team who fell a week ago and hit her nose. A little while ago, she sent me her pictures of the before and after, and like in 5 days, that wound scar had disappeared. There was no bruising. It was amazing, her recovery after that fall. Also, one of the things that we felt first that everybody loves is that it improves the quality of life, right? When you start using it, you start sleeping deeper, more repairing sleep for 8 hours without waking up. I remember I used to wake up like 5 times in the middle of the night, or any noise I heard, the cat was going by and I would wake up. And now it doesn't happen. I wake up maybe once during the whole night just to check on my son to see if he's doing well, and I sleep much deeper and many more hours in a row. It improves energy and mental clarity. This is amazing how people don't say, no, I'm not, I'm sick in my mental clarity. No, you don't say that, right? You say, oh, I'm losing my memory. I don't know where I leave my keys. I'm forgetting things. If they give me a phone number, I don't remember. So it's not an illness, right? But it is a super common symptom, your low memory and the lack of energy, right? So these are symptoms that are very characteristic of age as time passes. So the patch X39 helps quite a lot to give you energy, but it is a healthy energy. It is a sustainable energy. It's not peaks of energies and it's not falling energy that goes up and falls like when you drink too much coffee or when you drink energy drinks. This is a healthy and sustainable energy. It improves your relaxation, it improves your mood because it helps with inflammatory and oxidative stress. It helps you to be calmer. So that's why I said that it improves also wounds after surgeries. When I do a C-section or a hysterectomy, I give the
día
patches to my patients and I
para
ask them to
tenerlo
use
todo
them for at
siempre
least
claro,
10
¿verdad?
days.
Y esto es porque
Many
depende
don't
de
want
cada
to
la gente
purchase,
que
and that's
compra
completely normal
usa
because
por lo menos
people who
6 meses,
purchase them
pero
use
la
them
gente
for
que
at least
no
six
quiere
months.
comprar por
But
lo
people who
mismo
don't
les doy
want to
los
buy,
mini
they
packs
should
de
at
10
least have,
patches.
I should at
¿Sabes
least
qué?
give
El
them the
día que te
mini
opero,
pack of 10
empieza a
patches.
aplicar
You know
de
what? The
10
day
días.
that you have the
Y
surgery,
llegan a
start
los 10
using
días de
them and use them
aplicarte
for
los
10
productos
days.
y me dicen,
And
doctora,
after
no
10
invente, a
days, they
los
take off the
2 meses
stitches and
me
they're
da
like, Doctor,
cosa y ni me
after
sirvió
2 years,
y
I already had the
¿ves?
scar and it
Sí,
didn't even
¿verdad? Pero
hurt
es
and this and that.
importante.
And I said, you see, that's
Regenerador de
how
los
fast our
tejidos,
patch
reduce la
works.
inflamación
It
sistémica,
regenerates
hay un
systemic
rejuvenecimiento visible, los
inflammation,
mejores cambios
organs,
en el
and tissues.
100% a
And
nivel
there is
celular y
rejuvenation.
también
Remember,
a
we are
nivel
going to
sistémico.
rejuvenate in
Y
the
mejora
inside
la
at the cell
densidad
level and also in the
ósea, o
outside.
sea, de los
And it
huesos
improves
y
the
la
bone
densidad
density
muscular.
and the
¿Cómo se
muscle
usa?
density.
Este parche se usa
How do we
todos los
use
días
this? This
durante
patch is
12
used
horas
every
en todo
day
el día.
during 12 hours
¿Ok?
during the day.
Ya sabemos, las
Remember
localizaciones más
that
importantes
the
detrás del
most
cuello o
important
dos o
places
tres dedos
are
debajo del
behind the
ombligo.
neck or
Sin
two
embargo,
or
es
three
uno de los
fingers
patches que lo
underneath
puedes
the
pegar
belly button.
donde quieras.
Nevertheless, this is one
Yo
of
le
the
digo a mis
patches that you
pacientes,
can use
intenta
any
varias
part in your body.
localizaciones.
I
Esta
always
semana
tell
ponte
my
atrás del
patients,
cuello, la siguiente
try in
semana
different
debajo del
places. You
ombligo,
can
la
put it
siguiente semana
under the
ponte en el
neck,
antebrazo, la
under
siguiente
the
semana en el
belly
pecho
button the
o
next
así.
week,
O por ejemplo, donde te
behind
duela,
the
te lo
neck,
puedes poner
or you can put it
donde
on
tú
your
dices,
chest or on your
yo quiero
arm,
una
or
mano
where
que
you
me
have pain. For
reconozca
example,
algo
if
de
you
lo que
have
estoy
varicose
haciendo.
vein
Donde
that
tú
is
quieras,
really
va a funcionar. El ojo
causing
también, bien importante, no va a
disturbance, it's
funcionar
going to
en lo
work
que tú
wherever you put it on.
quieres.
Now, something
Va a
important,
funcionar
it's
en
not
lo que
going to work
necesita
exactly
tu
where you
cuerpo,
want it to work.
¿verdad?
It's
Porque a
going to
veces
go to
la
where your
gente dice,
body
yo, a mí
needs
me
it to
gusta que
work.
se me
Because
vuelva
sometimes
esta
people, they're like,
cueva.
oh, I really
Y le
want
digo,
this
bueno, sí, por
wrinkle to
supuesto,
disappear.
eventualmente
Okay,
se te
yes,
va
patch
a
yourself.
borrar
Eventually,
y
it
pasa
will
una semana y
disappear.
meses que no se me ha
And a week
borrado.
goes by and they're
Y
like,
le digo, pero si tienes
no, it
energía, mucho
hasn't
mejor.
disappeared
¿Cómo te
yet.
la
But
quieres
how's your
recuperar?
energy?
¿Qué tal?
Much better. How's your
Súper bien.
mental
¿Cómo está tu
clarity?
periodo
Much better.
menstrual?
How is
Increíble. Ah,
your
bueno, eso
period, your
necesitaba tu
menstruation?
cuerpo antes
Incredible. Well,
de
that's what your
borrarte la
body
arruga.
needed
Así que
before
seamos
erasing that wrinkle.
pacientes.
So let's be patient.
Importante, ya saben, también estar súper
Now, something
hidratados
important,
porque
it
estos
is
patches
super
funcionan
important to
con
be super
fosfos solar.
hydrated because these
Nuestra
patches work
luz,
with phototherapy.
la luz que
Our light
emitimos los seres humanos, que es una luz que
is
no
a
se
light that
ve,
humans
a simple
emit.
vista no
It's a
se ve,
light that we can't
pero
see
es una
with our
energía
simple
que estamos
eyesight, but it is an
emitiendo las
energy that we're
24 horas del día.
constantly
Entonces esta
emitting
luz es
the
la que
24
rebota en
hours a
el
day.
patch y
So this is a
refleja
light
esa
that
vibración
is reflected
específica
in
que
the
se ve
patch
y
back
que
into our
tiene que ver
body,
todo.
vibrating
¿Qué quieres
specifically
tomar?
that
¿Mucha
copper
agua o no
peptide.
excesa? Suficiente
If
agua y tu
you
cuerpo va a
drink
estar mejor
enough
hidratado a
water,
nivel
your body's
celular
going to be better
y a nivel
hydrated at a
energético
cellular
vas
level
a
and
tener
at an
mejor
energetic
conducción
level. You're going to have a
eléctrica, por
better
así decirlo.
electric
Entonces vas
conduction.
a permitir que el parche
So
funcione
you're
más
going to
rápido,
allow the patch
más
to work
potente y vas a
faster,
tener los beneficios en los
stronger.
primeros
You're
días.
going to receive the
Yo le digo a mis
benefits in the
pacientes,
first
o
days.
sea, todo el
I
mundo dice,
tell
toma
my
2 litros de
patients,
agua, pero
everybody
la
says,
verdad es de que
drink two
no,
liters of
cada
water,
persona
but the truth
necesita
is that no,
su cantidad
each
dependiendo de su
person
peso.
needs their
Entonces,
own
ahí
amount
anoten
of
en la
water
libreta
depending on
la
their
cantidad
weight.
correcta
So
de
write
agua que
down on your
debemos de
notebook the
tomar,
correct
es tu
amount of
peso
water that you must drink
multiplicado
is
por
your weight
35.
multiplied by
Ahí te van a
35.
salir los
There you're going to
mililitros.
see the milliliters that you need to be
Y bueno,
drinking.
pues ya lo conviertes en litros y esos son los
And you turn
mililitros
it
que
into
corresponden al
liters,
día.
and
Si
that's
en
the
tu
liters that you have
localidad
to
hace
drink a
muchísimo
day.
calor, como donde yo vivo,
If
aumenta
in
medio litro.
your
Y si también haces ejercicio, sudas bastante,
city is
aumentale
very
otro
hot,
medio
you
litro.
can increase half a liter. And
Entonces,
if you
no
do a
pasa
lot of
nada, a menos que
exercise and you
seas
sweat a lot,
igual
you can increase
el
another half a
50%
liter.
de
So
tus
there's no problem
que
unless you
tienen
or your
dificultades
customer
o
have
alteraciones
difficulties
renales, ahí sí
with
se limita el
renal
uso del agua o cuando
issues,
hay
then we do limit
cardiopatía.
the use of water
Ahí se
or when
limita
there
el
is a
uso de agua, pero
cardiopathy.
fuera de esos dos
But
casos,
out of those
puedes
two
tomar el agua que tú
cases,
quieras, pero eso sí vas a estar yendo
you
mucho
can
al
drink
baño,
as
te
much
desgastas la
water
vejiga,
as
te
you
van a un
want
montón de
out
cosas
of the
que ya
cases of
conocemos.
a heart disease or
Uso
renal
mínimo 3 a
problem.
6
Now,
meses.
use
Ojo acá,
minimum
mínimo.
three to
Uso
six
ideal
months. Remember,
toda la
I said
vida.
minimum. The
Y si tu
ideal
esposo
use is
quiere,
your whole life.
algo bien
So
importante,
here we
porque
have
yo
something
les quiero
very
poner,
important, and I always say this to
no
my
hay que
team.
rogarle a la gente que
We
use su
don't
patch,
have to
porque no
beg people
necesitan
to use the
que
patch
hay
because
que se ruegue. O sea, el
you don't
patch,
need to
el que lo
be
quiera usar y
begging.
esté
The
listo, lo va
patch,
a usar
whoever
y
wants to
solo
use
por
it and is
usarlo
ready will use it.
de
And
unos
just by
días,
using
semanas,
it after
va a
a few
tener que
days
va a
or
poner
weeks or months, it's going to convince you and they're going to want to continue using it their whole life. But if somebody says to you, hey, it's been 6 months and you said minimum 6 months, then I'm not going to use it anymore, that's fine.
Es importante
There's no
saber que el
problem.
efecto se va a mantener cierto tiempo, porque ya después de 6 meses, pues el cuerpo ya tiene
And you
tiempo
have
que
to
lo abre
understand that the
nuevamente.
effect
Pero esas
is
células
going to
madre
be
van a
there
cumplir su
for a
función
while
y se
because
van
now
a
your
volver a
body has a
dormir.
lot of
Entonces,
regenerated
después de
stem cells.
ciertos
But
días,
after
semanas,
a
meses, no
few
sé cómo se cuide la
weeks, months,
persona,
or however that
van
person
a volver
takes
a
care,
aparecer los
those
mismos
stem
síntomas
cells are
antes
going
de
to
esta
go
etapa.
dormant again because you're
Entonces,
not using
esto
the
no es
patch anymore
problema.
and you're going to feel the same
Esto
symptoms.
es un
So
fenómeno
this
natural
is a
donde
natural
le digo,
phenomenon
el cuerpo está
of
pagando,
aging. It
así
doesn't
como toda
mean
la vida
that
tengo que comer
your patches are, when you stop using the patches, they have that effect on you. You're just going back to your regular state. Your whole life, you need to be hydrated. Your whole life, you need to sleep well. Your whole life, you need to eat healthy. Your whole life, you need to meditate. Your whole life, we suggest using the patches, but it depends on the person. It doesn't interfere with any medication. If you have a person who is taking 1,000 medications, just make sure that person is not in active chemotherapy and they can use a patch with any medication. Even with heparin, which are the anticoagulants, there's no problem. They can still use it. It's a completely safe device for any age. Remember, there are no clinical studies in kids and in pregnant women, but there is medication based on evidence. That means that there are many pregnant women who have used it and it's going spectacular, and many kids whose moms patch them and things are going extraordinary for them. That's medication based on evidence. Clinical trials or testimonials that have no second effects but do help a lot. So it really depends on the person who's pregnant if she chooses to use it. Me, on my patients, I recommend it when they are pregnant. I'm not a pediatrician. I don't work with kids. The only kid who I've patched is my own son because Jimena, choose that. You just have to give the information, and every mom or dad takes a decision, or any pregnant woman. Understand? Now let's pass to X39, which is like the brother of the X39. It works very similarly. It's the same thing, the same mechanism of action, but the nanocrystals of the X39 are positioned in a different way in the X49, and that way X49 activates a different peptide, which is AHK. It is very similar, only one letter changes. The letter before in X39 was GHK, and this one is AHK. So we change glycine by alanine. That is the only difference. But then they have different effects. This patch X49 is going to regulate our genetic expression. It's going to stimulate the tissue regeneration and the cellular body. But this is more focused on to the muscle, the skeleton, the bones, the cardiovascular system, and the immune system. Those four things. So I love it. It's one of the ones that I use most every day, and I love them. And what are the benefits of X49? Number one is it increases energy, especially when you do exercise. The difference to X39 is that it's going to increase energy if you do or if you don't do exercise. X49 is more specific for exercise. If you use X49 and you do exercise, your strength, your stamina is going to increase. You're going to be able to stay longer in the gym in your routine and you're going to recover much faster. I'm going to the gym and before I couldn't even move my arms after doing arm. I couldn't even walk upstairs after doing legs. Now, I do have pain in the muscle, but not as much as before. Just like a 60% less, I think. And I carry more weight now than before because X39 and X49 are helping me for that. And since you do more exercise in the gym, you have a better muscle tonification, better density and strength in bones. And as I was saying, it's also focused in helping your heart and the whole circulatory system. When you give the circulatory system this maintenance, it's going to improve the blood flow. So all patients with cardiopathy, with any illness in the heart, is going to receive a benefit from X49 and X39. It also reduces oxidative stress. It helps to reduce body fat as long as we do exercise and we increase physical exercise. How do you use it? You also use it 12 hours a day. You can put it underneath your belly button or behind the neck, or you can also put this one wherever you prefer. You can also drink electrolytes without sugar, or electrolytes or water with a bit of Himalaya salt or sea salt with water and lemon. You have to be very hydrated and have enough electrolytes. Also, minimum 6 months. That's my basic recommendation. Minimum 6 months. Even though David Smith said 3 months, truthfully, yes, in 3 months, everybody in 3 months feels okay. But I've read that it's better to use minimum for 6 months. For what? For the body to be more concentrated with this peptide. Okay? This patch X39 does not replace X39. X49 and X39 do a synergy. They work together. It's called a powerful regenerative duo. When you use them together, you feel spectacular. I feel like a superwoman when I use them together. They are recommended for people who are active, people that like to do exercise, that are competing, and also in menopause or after 35 years onward, everybody, not only athletes, everybody should use it. Also, people who are sedentary, so they don't lose muscle mass, because with time and with age, sarcopenia arise, which is losing muscle mass, and that makes there to be an accelerated growth in illnesses, in fatigue, and that's when the body starts being seen smaller and thinner and older. And we can avoid this with the use of X39. And can kids use this? I don't think so. This is not useful for kids. Pregnant women, I don't think this is useful for pregnant women either. Next patch. This is also the Eon patch, the one that we've heard about a lot, however you want to call it. And I called it the anti-stress, anti-inflammatory, and cellular rejuvenation patch. Because truly, I think that this one with the X39 is the one that everybody should use. Why? Because this reduces cortisol, which is a stress hormone, and we are all stressed, and also reduces inflammation, and everybody is swollen. Just with breathing or having a bit of sun, or if suddenly you drank a Coke, or if suddenly you ate that piece of bread, that is already causing inflammation and oxidation. So, this is super important for those kinds of situations. What it does is it models the reply of the body before stress and reduces oxidative stress and systemic oxidation. So this patch is not going to make you not stress out, okay? You're going to feel stressed because life is that way. What it is going to do is it's going to do a protective shield amongst that stress so it doesn't affect you so much at a cellular level. It's also called the calming patch or the happiness patch because truly, yes, when you regulate your cortisol, you start being feeling happier and more relaxed. So the ion is amazing. It alleviates pain also related with inflammatory processes like rheumatoid arthritis, fibromyalgia, tendinitis. This doesn't take away the pain. So yes, it will help you with losing inflammation where you have migraine, but it won't take away the pain of the migraine. It does take away the pain if you have arthritis inflammation. It helps you with your mood. It makes you feel relaxed. It also has an effect at an immune system level, and it also helps to maintain homeostasis, which is the balance of your body. You can use it for 12 hours on, and this one you can use it during the day or during the night. What does it depend on? For example, if you have issues to sleep, I would ask you to use it at night for 12 hours. But if you sleep spectacularly and what disturbs you a bit is that you're feeling very stressed or angry or things like that, then use it during the day. So, depending on each person, you can recommend it during the day or at night, but always 12 hours on and 12 hours off to rest from it. This is recommended to use between in the back, between the shoulder blades. Or look at here. You can see the place where I love to put the patch on in the area of the thymus because it regulates the immune system and the emotions, the thymus. So it's like giving that stimuli in the meridian, in the center of the body. You can also put it on the C7, which is the seventh vertical, and also minimum 6 months of use. This is something that you use more with people with constant stress because I think that we all have stress. Or, as I said, inflammatory illnesses, people with pain, or alteration in their immune system. Fourth patch, glutathione. This is amazing, the glutathione, because most of the people already know glutathione. It is the master antioxidant in our body, but with age, after 20 or 25 years old, we start to reduce our glutathione. And obviously, there are alterations in the immune system. The body doesn't disintoxicate like before, and we start to accumulate toxins. So look at
glutatión es
this.
un
Glutathione
como
is
invertido, perdón, por tres. Glutamina,
tripeptide
cisteína
made
y
by three,
glicina.
glutamine,
Pero no hay
cysteamine, and
manera
glycine.
de que
But there
exista
is no
glutathione
way for
tomada.
glutathione to
Si alguien te
exist
está
if you
vendiendo
take it
glutatión tomada,
orally.
no
If
es
somebody is
glutatión.
selling you
Ojo, ojo a
glutathione
eso,
orally
porque
taken, that's
glutatión
not glutathione. Pay attention to that because
se deshace
glutathione
con los jugos gástricos, o sea,
glutathione
se
dissolves with
inactivan.
gastric
Por lo tanto,
juices.
o te lo tienen que dar
So
los
either
tres,
they have
los
to
tres
give it to
péptidos, pero
you,
están por
all
separado.
three of them, the three peptides
Y
separately.
bueno, ya cuando entra a tu cuerpo,
And
tiene
when
un
they
efecto,
are in your
no al
body, they have an
100%,
effect.
pero bueno,
Yes,
mínimo
it's
nos
not
sube el 20,
100%,
30, 40,
but they do have a
50%.
20, 30, 40,
Otro lo tienes que
50%
poner en
effect.
sueroterapia.
Others
Y
have
te lo
to
ponen en
be injected
sueroterapia y te
in
sube, cuando tienes el suero de
therapy
glutatión, te
injection.
sube
When you have a
un
glutathione
80, 100%,
serum,
mientras tienes el
your
suero puesto.
glutathione
Ya
goes
que
up in
esto
an
acabó
80
el
to
suero,
100% while you have it on.
imagínate 4
Once
a
the
6
serum
horas,
is finished, in
quitas
the next
glutatión,
4 to 6
se dispara.
hours,
Entonces
they
tendríamos
disappear.
que ponernos
So
sueroterapia
then
todos
we
los
would
días
have
y
to
eso no es
use
posible.
the
Por lo tanto, la
serum
única
therapy
manera
every day, and
de
that's
elevar
not
tu
possible.
glutatión
So
de
the
manera
only way
natural
to
es
elevate
con el
your
parche. Fíjate,
glutathione in a
les
natural
dije la
way
buena noticia,
is with the
cuando te pones
glutathione
el
patch.
parche en
But the
las
good
primeras
news is
24
that when
horas
you use the
vas a
patch in the
elevar
first
un
24 hours, you're going to
300% tu
elevate them
glutatión.
by a
O sea,
300% your
no hay
glutathione.
otra manera
So
de
there is no
lograrlo
other
con este
way to
parche.
achieve
¿Y de
this
qué sirve
except
que
for with our
tengamos el
patch.
glutatión tan
And
alto? Bueno,
what
pues
is
porque
it
va a
useful for
neutralizar
to
los
have such a high
radicales libres
glutathione?
que nos
It's going
enferman, nos
to
intoxican. Va a
neutralize the
desintoxicar el
free
hígado,
radicals
los
that
riñones, el
intoxicate us. It's
sistema
going to
linfático. Es como una
disintoxicate the
limpieza
liver,
profunda
the
de todo tu
kidneys,
cuerpo,
the lymphatic
apoya la
system. It's
función
like a profound
inmunológica,
cleaning of your
algo aquí
whole
bien
body.
importante.
It
No es que
helps
el
the immune
glutatión
system. Something very
fortalezca el
important.
sistema
It doesn't
inmune.
mean that
El
glutathione
glutatión te
makes your immune
equilibra tu
system
sistema
stronger.
inmune. ¿Por qué lo
Glutathione
comento?
balances
Porque hay
your
muchas
immune system. Why do
enfermedades
I talk
que
about this?
se
Because
caracterizan por un
there are
sistema
many
inmune
illnesses
muy
that are
hiperactivo, o sea, muy
characterized by a
aumentado,
very
y lo que
hyperactive
queremos, o
immune
sea,
system, a very excited
altamente
immune system. So what we
inmunosupresores
want, what they give these people
para que en
is
vez de que tengamos
immunosuppressors. So instead of having such a high
desequilibrios,
immune
como por
system,
ejemplo
it
artritis,
is balanced. Like
lupus,
for example,
reumatoide,
arthritis, lupus,
esclerosis, fibromialgia, o sea,
sclerosis,
estas personas algunas
fibromyalgia. These
veces
people
necesitan inmunosupresores para que el sistema
sometimes
inmune
receive
está tan
immunosuppressors,
alocado
so their
que
immune system,
regule.
instead of going so
Y en
crazy,
otros
starts getting
casos, el sistema
regulated.
inmune está tan
And
bajo
in
por
other
el
cases, the immune
cáncer, el
system is so low, for
VIH,
example, in
infecciones.
cancer and
Cuando está tan
HIV
bajo,
and other infections,
les
it's so
damos
low
algún
that
antioxidante para
we give them an
fortalecerlo. Total, que esta
antioxidant to
glutathione, este
strengthen it.
parche nos
So
ayuda
this
a equilibrar
glutathione, this
el
patch,
sistema inmune.
helps
Entonces,
us
si
to
tu
balance the
cliente o
immune
tú
system.
tienes tu
So
sistema
if
inmune
your
muy
body
elevado,
or
esto te
you,
lo normaliza. Y si
if
está
you or
muy
your
bajo, esto
customer
te lo
have this
normaliza.
very
Y
high,
no hay
this
contraindicación. Todo el
balances
mundo puede
out.
usar
So
el
there's no
glutatión.
counterindication. Everybody
También
can
ayuda un
use
poquito a dar
glutathione. It
mejor
also
claridad
helps a
mental y
bit to have
rendimiento
more
físico.
mental clarity and physical
Entonces, como yo les dije, aumenta
strength.
nuestro
So as
glutatión
I
en un
said,
300%,
it improves our
ayuda a
glutathione in a
eliminar metales pesados.
300%.
Esto es bien
It
importante
helps to
porque de repente
eliminate
el
the
aluminio
heavy
en los
metals. That's something
desodorantes
very
y
important
de
because suddenly
repente el
aluminum
mercurio en los pescados y el
in
cadmio y quién
deodorants
sabe
and
dónde. Entonces,
mercury in
estamos
fish and
expuestos a
all that, we
muchísimos
are
metales
exposed
pesados
to
que o los
many
absorbemos por la
heavy
piel o los
metals that are
respiramos y nos
absorbed
tienen
via the
peligrosos a nivel
skin
del sistema
or
nervioso
that we
central
breathe, and
y nos
that's very
intoxican. Pero
dangerous
también
at
son
a
precursores de cáncer.
central
Con el
nervous
glutatión estamos
system, but they're
eliminando
also
los
cancer
metales
precursion. So we
pesados.
are
Cuando hay
eliminating
alguien
these
con hígado
heavy
graso,
metals. Where
sí
there's
o sí
somebody
tiene
with
que
a
usar
fatty liver,
glutatión porque le va
they
a
have
ayudar
to
con
use
una
glutathione. Yes
desintoxicación, una
or
limpieza
yes,
hepática.
because it
En
disintoxicates and
protocolos
it
después de la
does a hepatic
quimioterapia, ya
cleaning
saben
in
que la
protocols.
quimioterapia es una
After
toxina muy
chemotherapy, you
fuerte que
know that
mata células de
chemotherapy is
cáncer,
a
pero
very
también
strong
mata células sanas. Y entonces,
toxin that kills
después de
cancer
una
cells but
quimioterapia,
also kills
se
healthy
recomienda mucho
cells.
el
So
glutatión
after
o
chemotherapy,
incluso
glutathione is
durante
very
la
recommended,
quimioterapia. No
or
está
even during
contraindicado con la
chemotherapy.
quimioterapia usar el
There's no
glutatión.
counterindication with
Entonces,
chemotherapy to use
permite que se
glutathione.
desintoxique el
So
cuerpo de
it
cualquier
allows the
bicho que haya
body to
salido con las quimios,
disintoxicate from all the
refuerza el sistema inmune,
toxins from the
neutraliza el estrés
chemotherapy.
oxidativo,
It
aumenta la
strengthens the
energía,
immune
también la claridad
system.
mental, porque
It takes
imagínate
away the
una,
oxidative
un cerebro y
stress.
una,
It
un
helps
cuerpo
with
bien
mental clarity
contaminados, pues
because
no va a estar
imagine a
bien.
body that is very
Pero si los
contaminated and
limpias por
has a brain that
completo,
is very
toda tu
contaminated.
maquinaria
But if
a
you
nivel
completely
cerebral,
clean that, all
neuronal,
your
va a
mechanism in
estar
your brain
funcionando de
and your body
maravilla.
is going to be
Previene
working
el envejecimiento
amazingly.
prematuro
It
y
prevents
previene el deterioro
premature
del
aging
ADN.
and it prevents
¿Cómo se usa?
the
También se usa
DNA
durante
deterioration.
12 horas.
How do you use
Algunos
them? You also
recomiendan
use
en el
it during
día,
12 hours.
pero
I
no
also
tienes que
recommended during the day, but this is recommended to be used only 2 to 3 days a
en
week.
donde puede pegarse debajo del
Okay,
ombligo
where
o
you can
también
put it
sobre el
underneath
cinturón
your belly
o entre
button
las
or on your
omóplatos
thymus
o
or
también en el
between
pie derecho,
your
entre el dedo gordo y
back
el índice,
or
como en este
between
nivel, pero del pie.
the
Hay varios puntos. Al final
big
traje una
toe
imagen de
and
cuáles
the
son los
foot.
puntos
There's
más
different
recomendables,
places where you can put
pero
them
les
on. I have
repito
an
nada
image
más
of the most
recomendarles
recommendable ones.
uso mínimo, ya saben, 3 a 6
Minimum
meses.
use, 3 to 6 months.
¿A quién se le recomienda? Enfermedades
Who has
crónicas,
this recommended
enfermedades
for chronic
autoinmunes, adultos
indices,
mayores,
autoimmune
personas que ya con
illnesses,
la edad se van perdiendo la función,
adults who are
personas
older in
expuestas a
age and are losing
toxinas,
glutathione, people who are
personas en
exposed to
tratamiento con cáncer
toxins,
o post-COVID
people's
o
in
cualquier persona
cancer
que quiera tener su
treatment or
sistema inmune
post-COVID, or
equilibrado.
anybody who wants to have a
El
balanced
siguiente es
immune
el
system.
carnosine.
The next one is
El carnosine
carnosine.
aumenta nuestros
Carnosine
niveles de carnosina
increases
en el
our
cuerpo,
levels of carnosine in
que
our
ayuda
body,
mucho a
which
nivel
helps very
cerebral.
much
El
at
carnosine
brain level.
tiene,
Carnosine
yo le diría que es también
has,
como primo hermano del
I say that
X39.
is
Porque también
also a
tiene
cousin of
propiedades de
X39 because it also
regeneración de
has
tejidos. No funciona
regeneration
igual que el
properties for
X39,
tissues.
pero
It doesn't
también
work
ayuda a
exactly like
regenerar
X39,
esos
but
tejidos.
it does help to
Está
regenerate
formado
certain
la
tissues.
carnosina por
Carnosine
beta-alanina y
is
histidina. Si
created
se dan cuenta,
by
son péptidos, son
betacine,
proteínas que el
carnosine, and
cuerpo
pepsine. It's
necesita.
peptides
Y
that the body needs.
estas proteínas,
And
estos
these
péptidos, los
proteins or
encontramos en el
these
cerebro,
peptides, we can
en los
find them
músculos,
in
en el
the
corazón y en
muscles, in
algunos
the
órganos
brain,
vitales.
in the heart,
Por
and in
eso
other
el
vital organs.
carnosine se da
That is why
siempre
this
cuando hay
carnosine
alteraciones
will
cerebrales, por
is always
ejemplo,
there when we have brain
deficiencias en Lewy,
alterations, like for example,
Alzheimer,
senile
Parkinson,
dementia, Alzheimer,
o niños
Parkinson,
con autismo,
or
TDA,
kids with
Asperger, todo
autism,
esto. También
ADHD,
cuando hay un
Asperger,
problema del
and all this.
corazón,
Also,
también
when
es
there are heart
importante.
issues, it also
El
helps a lot.
X39 y el carnosine
X49 and
están
carnosine
específicamente diseñados
are
para
specifically
a
designed
reparar
to repair
desafíos del corazón.
any heart
Ayuda
challenges.
a mejorar la
It
resistencia
helps to
física también, previene
improve
la
physical
glicación. Esto es bien
resistance.
importante
It
que chequen.
prevents
La
glycation.
glicación,
This is very
imagínense,
important because
ustedes
glycation, you
conocen,
can
bueno, en
imagine.
México son bien
Do you
comunes
know, well,
los
in Mexico, it is
cacahuates
very common
gelatina.
to eat
A lo mejor
those
los conocen y a lo
peanuts
mejor
that are
algunos de
sweet.
ustedes no, Rachel,
Maybe
si
you
los conoce.
know
Pues
them,
imagínate
maybe
que es un
some of you
cacahuate que
don't.
está
But
relleno de
imagine it
azúcar.
is a peanut that
Ese
is
es un cacahuate
full of
gelatinado.
sugar. That
Esto
is
de
a
la
sweet peanut.
glicación, a eso
This
se refiere, que
glycation,
primero
that
las
is what it talks
proteínas de
about.
tu
First,
cuerpo se
the
empiezan a
proteins in
glicar,
your
o
body
sea, se
starts
empiezan a
to
llenar de
glycate.
azúcar.
So they
Y
start to
después
be
estas
filled with
proteínas
sugar. And
glicadas
after those
entran a la célula
glycated
y
proteins
tus células,
are introduced
imagínate que
in the
se
cells,
convierten
and
en
the
un
cells,
cacahuate
imagine that
gelatinado.
they
Células
become
se
a
empiezan a
sweet
llenar de
peanut.
azúcar.
Your
A esto
cells
se le conoce
start
como
getting filled with
glicación
sugar.
y
That's what
esto
we
pues
call
acelera el
glycation. And this
envejecimiento celular,
accelerates
obviamente
the
aumenta tu riesgo de
cellular
enfermedades,
aging,
pero también
and
aumenta tu riesgo de padecer
increases
cualquier
your
enfermedad, porque ya tus
possibility of being a
proteínas de tu
diabetic
célula
or any other
empiezan
illness
a
because
crecer.
now your
Eso es
cells are already
glycation.
sure
Entonces,
full
este
of sugar.
carnosine
That's
se
glycation.
tiene
So
que
this
filtrar eso en
carnosine
tu cuerpo.
prevents
Si
this
juntas
happening
el
in your body.
carnosine
If you
y
use
al mismo tiempo el
carnosine
X39,
and at the
pues
same time
es una cosa
X39,
muy buena,
this is a
como
very
detector
good
problemático, porque
synergy
el
when you have this
carnosine,
kind of problems
imagínate
because
que todas
carnosine,
tus células,
imagine that
la
out of
mitad
all
ya
your stem
está
cells, half of
glicada
them
y la
are
otra
already
mitad no.
glycated and
Entonces,
the
¿qué
other
va a
half
pasar?
are not.
Que el
So
carnosine
what
te
is
va a
going to
proteger
happen?
tus
That
células
carnosine is
sanas que
going to
todavía no están
protect
glicadas,
your
te las va a
healthy
poner un
stem cells
escudote, pero el
that
X39
are
te va a
not
ayudar a reparar
glycated, but
las
X39
actividades
is
que
going to
están
help you
en
repair the
glicas.
ones who are in
¿Ok?
process of
Es un
glycation. Okay?
neuroprotector, o sea,
It is
protege
a
a nivel neurológico
neuroprotector.
porque
It
está
helps at a
en estas
neurological level.
alteraciones del cerebro y
That's why
del
you have
corazón.
it in brain
Y
and
bueno,
heart
mejora, beneficios son
alterations.
que
And
mejora el
it improves,
rendimiento
the
a nivel
benefits is that it
ejercicio, mejora la
improves
resistencia muscular,
the
protege tu corazón y
exercise,
músculos,
stamina,
estimula
energy,
la claridad
muscles,
mental
heart,
también. Todas las
stimulates
personas que ya
mental
con el
clarity.
cerebro les
Everything
ayuda
that has
mucho a
to do with
mejorar.
the brain is
Protege contra
improved
la
very much.
degeneración
It
cerebral por
protects
ahí
against
y
brain
genéticamente si tienes
degeneration. If
familiares con
genetically you have
Alzheimer o
family
síndrome de
members with
Lewy o
Alzheimer
Parkinson,
or
te
mental
recomiendo que lo
dementia or
uses
Parkinson, I
antes de que
recommend that you
te
use
dé.
it
Espero que no te
before
dé,
you get
pero
it. And I
bueno,
hope you
estaría
don't.
siendo como un
But
preventivo
this
súper
would be like a
poderoso.
super
Y si
powerful
ya tengo a mi
preventive.
familiar que
And
ya
if I already
padece
have
de
my family who
Parkinson
already
o
has
demencia,
Alzheimer's and
claro que
Parkinson
también
or
lo puede
dementia,
usar para
of course that
detener el
person
daño
can use it
cerebral.
to stop
Inclusive
the
con el tiempo puede
brain
haber hasta
damage. And even
regresión.
with time, there
Eso
could be a
está
regression.
espectacular.
Now
Acuérdense
that
combinado
is
con el
truly spectacular.
X39.
Remember,
Muy
recommended by
bien.
X
Se
by
usa
using
12 horas
X39.
también lo recomienda
You
en
can use it
ayunas.
for 12
Yo se
hours.
lo
I
recomiendo
recommend that
2 o
during the
5 días
day,
a
and
la
I recommend
semana.
from
Yo no
2 to
puedo
5 days
con
a week.
carnosina y
What I do
glutatión
with carnosine
porque
and
un día uso
glutathione is that
glutatión
one
y
day I
al
use
otro día no.
glutathione, and the next
Y
day I
al
use
otro glutatión
carnosine,
y al
and the
otro
next day
carnosina y
glutathione,
así
and the
me la
next
voy
day
llevando y ya
carnosine.
digo,
And that's what I
me
do. And
siento
I've been like this for many
espectacular.
months, and I feel spectacular.
Se recomienda debajo del ombligo
And
o
is
en la
recommended
vertebral
underneath the belly button
7 o también
or
de los
in the
neonatos
vertebrate
o arriba
7
del
or
pecho también.
between the back plates
¿Para
or
quién está
above the
recomendado?
chest too.
Adultos
Who is this
mayores, porque
recommended
recuerden que
for?
una de sus funciones es
Elderly adults,
proteger
because
al
remember that
cerebro,
one of the
pero también
functions
proteger al
is
corazón.
protecting the brain, but also
Entonces, pues
protecting
con
the
la
heart.
edad se van
So
como
with
desprotegiendo
age,
estos
you start
órganos
losing that protection in
vitales y
those
con el
vital
carnosine
organs,
los
and with
podemos
carnosin,
proteger.
we can protect
Gente
them.
que quiere envejecer con vitalidad.
People
La
who
verdad es que
want
hay
to
gente que yo
age
les
with
digo, ya son de
vitality.
la
The
tercera
truth
edad
is
y
that
les
there
digo,
are
niña,
people
tienes
that I
cáncer de
call them that they
mamára,
are very elderly and they're, oh, the patch is going to help you to feel better. And they're like, no,
Por
I'm
eso.
already
No,
old.
pero pues
That's
sí,
what
sí,
they
ya, o sea,
say.
no,
And the
que,
answer is like,
híjole, pues ya, yo
well, that's
no,
why. No,
quiero
but
mi
what
tiempo con
for?
gente que no está
They
lista
like,
para el
I don't want
patch,
to lose my
vamos a
time
darle
with people who
tiempo.
are not ready
Pero
for
si
the
hay
patch.
mucha gente
We
de
shouldn't
la
lose our
tercera
time.
edad
But there are
que
many
viene al
people,
consultorio y me dice,
elderly
Jimena,
people who
yo
come
ya sé
to
que
my
estoy
medical
grande,
consultation
pero
and
me
say,
quiero
Jimena, I
sentir
know that
ahora,
I'm
en el
old,
tiempo que
but I
Dios
want to
tiene
feel
permitido,
well now. And
quiero
however time,
sentirme
much
bien,
time
quiero
that God
ser
gives me of life, I
independiente.
want to feel
¿Qué
well. I
tú me
want to be
puedes
independent.
recomendar? Y
What can
ya
you
la gente que está
recommend me?
lista para esto,
And
yo le pongo
whoever
el
is
patch
ready
de
for this, I
39
recommend the
base,
patch
el
X39,
49 y
firstly,
carnosine para
X39
todas
and
las personas que quieren
carnosine
envejecer con
for whoever
vitalidad. También
wants
esto
to
se puede
age with
utilizar para
vitality.
ciertas personas
You
con
can also
déficit de
use it in
atención,
athletes,
autismo,
people with
trastornos
attention deficit,
neurológicos
autism,
y
and
también para
any
por ejemplo,
neurological
psoriásica, porque acuérdense que regenera muy rápido.
diagnose, and also to
El
regenerate
otro
skin.
parche, el SP6, este es el
The
parche
next
también
patch,
favorito de las
SP6, this
mujeres.
is the
Lo
favorite
puede usar
patch for
hombres
a
y
woman.
mujeres, ojo acá.
Women or
Pero
men
este
can use it.
parche
But this patch
tiene dos características fundamentales.
has
Número uno,
two
equilibra el
main
metabolismo.
features. Number one, it
Número dos,
balances your
controla el
metabolism.
apetito. O sea,
Number
reduce
two,
los
it
antojos,
controls
pero
appetite. It
el antojo de lo que te
reduces
hace daño. Se reduce el
the
antojo de
wanting
azúcares,
of things
harinas,
that hurt you, like
alcohol,
sugars,
tabaco,
flour,
drogas.
alcohol,
Entonces
tobacco,
se te va
drugs,
reduciendo esos antojos y cosas que
those
te afectan.
things that
Y
affect you
al
start being
equilibrarse
reduced.
todo
And
tu
once
metabolismo,
you
también
balance your
tienes
whole
función a
metabolism,
nivel
starts to have
hormonal.
a function
Regula
at a
también las
hormone
hormonas. Por eso,
level.
como
It also
personas con
regulates
sobrepeso,
hormones.
personas con
So people with
climaterio,
overweight or
menopáusicas, o
people with
posmenopáusicas,
menopause or
nos va
postmenopause,
espectacular con el
it is
SP6.
spectacular for them to
Están de
use
moda las
SP6.
inyecciones
We
cosméticas, el
also
Ozempic y todo eso,
use
y también la gente abusa
injections.
de las
Yes, a
inyecciones
lot
para
of
bajar
people
de peso.
love
Sí, sí bajas de
injections and
peso,
they
pero con un
abuse to
antojo que
lose
te
weight. Yes, you
desestabiliza.
lose weight, but with a
Con tu
lot
patch
of adverse
SP6
effects. With the
X39 puedes tener
SPC
los
patch
mismos
and
efectos
X39,
que
you
los
can have
Ozempic.
the
Te
same
bajas las
effects
inyecciones,
and
pero sin el
without
tratamiento ya.
needing all those
Y la misma
injections
con
and all those
yo no
adverse
pude bajar de
effects.
peso con
And I
nada,
know it. I
obviamente no
couldn't
intenté
lose
nada,
weight
no
with
fui con
anything.
el médico porque
Obviously,
todo esto
nothing.
lo
I didn't
natural,
take any medication
pero
because
ya
I
casi
like
me estaba
everything
perdiendo la
natural.
esperanza.
But
Dije,
I
híjole,
was
ya me estoy
losing
sintiendo bien
my
gordita, pero no. Empecé
hope.
a
I
usar el
was like, no,
SP6
I'm
y
going to
dije,
stay
híjole,
fat.
es una
And no, I
montaña,
started
son
using
10 kilos,
X39 and I already
mejora la
reduced
energía
7
increíble. Y hay mucha
kilos, two
gente
sizes,
que
and
ha
I feel
bajado
an amazing energy.
muchísimo,
And
de
there's
20
many
30
people that
kilos,
have lost a lot,
solo con
10,
este
20, 30
69 y el
kilos just by
SP6.
using X39 and
Entonces, ¿este qué
SP6.
va a hacer? Va a activar los
So what
meridianos
is this going to do?
relacionados
It
con
will
el sistema
activate the meridians
digestivo,
that are
el
related with the
sistema
digestive
hormonal
system,
y el sistema
with the hormonic
nervioso. Por eso
system,
nos
and the
bajan
nervous system.
los antojos.
That is
Ya no
why
tienes esa
we don't
ansiedad de
feel
andar
like
comiendo
eating
y andar
junk food because we
checando.
don't have that anxiety of
Con que
wanting
ya
to eat.
comiste,
You
quédate
are calmer.
satisfecha
You already
y estás
ate,
a
you're
gusto.
satisfied,
Y ya
and
después de
you
3 4
feel fine.
horas,
And
la
after
hambre,
3 or 4 hours, you're
tranquilamente,
hungry
pero
and
sin
you
antojo.
eat
Dije, no tengo
calmly
hambre. Son
without
diferentes.
junk
Sin
food. It's
antojo es,
different.
me
It's
como lo que me
different when
quieran
you
poner.
want to eat whatever they put in front of
Hambre
you.
es, yo elijo
And
cómo
hunger
nutrir y qué
is
meterle a mi
not a
cuerpo.
craving, it's I
Entonces
choose
está
how
padrísimo cuando
to
empiezas a comer
nurture
por hambre,
my
que
body and
eliges
what to
lo
put in your
saludable,
body. So
a
it's
que
much
te
better
estés
when you eat
guiando por
because you're
puros
hungry and you
antojos.
use healthy than when you just
Ok,
have a craving.
entonces esto está espectacular.
Okay, so
Uno,
that is
regula apetito,
spectacular.
reduce
We saw
antojos,
that it
apoya de manera
regulates
natural a perder
appetite,
peso,
reduces the
acelera el
cravings, it
metabolismo, o
helps
sea, también
naturally
te va
to
a dar
lose weight, it
energía el
accelerates the
SP6,
metabolism.
equilibra las
SP6 gives you
hormonas,
energy,
leptina y
it
grelina, que son
balances
las hormonas del
hormones,
hambre y
Netrila and
saciedad.
Grelina, that are the
No andes
hormones of
con hambre todo
hunger
el santo día,
and
pero también
help
para
you
que
not to
no
be hungry all
estés
day.
comiendo y digas, ay, siento que ya comí mucho, pero
And
no
they help
entiendo.
you
Y lo sigo
feel
haciendo.
full.
Y
So you
hasta que
don't
me
think, oh,
llene.
I'm eating
Pero
and
si
eating and I
tienes
don't feel
alteraciones de
full.
la
If
grelina, pues
you
te vas a
have
quedar
alterations in your
lleno hasta que
ghrelin,
ya te
you're never
estás
going to feel
rodando.
satisfied
Entonces,
until your
este
stomach
parche
hurts.
equilibra estas
So
dos
what this
hormonas y
patch
es más
does,
fácil
it
y hace que
balances these
alimente
two
con menos
hormones and it's
comida
easier to
y es
be
más fácil
satisfied with
que
less food and
ya no
it's
tengas esos
easier
antojos
for
traicioneros.
you to not have
Aumenta
those
la vitalidad, te
trader's
ayuda también a
cravings. It
nutrir
improves
a
vitality
nivel de
without using
energía,
caffeine or
reduce la
stimuli.
fatiga
It
por
improves
desequilibrio
energy, reduces
hormonal, cosa que les
fatigue
pasa mucho a
due
las
to
personas que estamos en
hormone
climaterio menopáusico,
unbalance
que
that
nos
happens a
encanta
lot to
trabajar
people who
y
are
de
in
repente,
menopause.
plum, te da una energía
We feel
genial.
very tired,
Yo lo
but this
recomiendo
patch gives you
siempre
an
justo cuando
amazing
me dicen
energy. I always
39.
recommend it with
Reduce ansiedad a la hora de
X39.
comer y
It reduces
mejora la relación
anxiety for
mente-cuerpo en
food
procesos de
and it
cambio de
improves the
hábitos. Bien
mind
importante explicar a
body
nuestros clientes, no es nada
habits.
más
It's very important to educate our customers. It's not only wear the patch and that's all. No, I have to educate them on how to eat, how much water to drink, and all that. You patch them a day for 12 hours, also during the day. You have to use this one every day. It's not an alternate days, it's every day. And this does have specific localizations, especially to be able to stimulate the specific meridians. The most important
en la pierna
recommendation
izquierda,
would
siempre
be on the
del
left
lado
leg. It's
izquierdo
always
del pie.
going
Ok,
to be on the left
entonces,
side, the
primera
SP6.
recomendación,
So
en
the
la
first
pierna izquierda,
recommendation on
cuatro
the
dedos
left
arriba del
leg, four
tobillo,
fingers
pero
above
en la
the
parte
ankle,
interna
but
de la
in
pierna
the inner
izquierda. Ahorita
part
les voy
of
a
the
mostrar
left
las
leg.
imágenes,
Now I'm going to
¿ok?
show you the images, okay?
También se puede poner debajo de la rodilla,
You can also put
igual
it
en la
underneath
pierna
your knee,
izquierda, pero
also
ahora
on the
a la
left
externa o
leg,
por
but on the
fuera,
outside.
¿ok? ¿A quién le vamos a recomendar el
Who
SPC?
are we going to
Personas que
recommend
desean perder
SB6
peso,
to?
pero de
People who
manera
want to lose
natural,
weight
quienes están
in a
muy
natural
preocupados porque todo
way,
el tiempo andan
who
con
are
antojos,
concerned
ansiedad por
because they
comer,
always have craving and
mujeres
anxiety to eat,
en menopausia,
women
hombres con
in
andropausia, mujeres
menopause,
con
women
resistencia a la insulina
who
o
have
ovario poliquístico,
resistance to
también les va a
insulin
interesar.
or
Igual,
polycystic
también
ovaries. It's also
fíjense que
spectacular.
lo estoy
And
usando en
also, I
mujeres que no se
have
han
been
podido
using
embarazar,
it in
junto
patients who
con el
have not been able to
X39 y el
become pregnant with
glutatión, les
X39 and
endulzan el
glutathione,
vientre.
and it's gone
Muy bien
really
por su
well,
fibra y
very,
también de
very
las
well,
hormonas.
because
Y
it
también en
balances
pacientes
hormones.
en
And
rehabilitación por
also in
recuperación
patients in
post-cirúrgica.
rehabilitation or
Este está muy
post-surgery
fácil,
recovery.
el patch 7.
This
Ya
is very
estamos
easy, the patch
terminando.
7, okay?
El
We
patch
are
7 es el
finishing.
Silent Night.
Patch
Aquí
7 is
como que no hay
Silent Nights.
pierde,
Here, there is
porque es un
no
patch
loss
que
in what
ayuda a
it does
dormir.
because it's a
Su
patch that helps you
mecanismo de
sleep.
acción es
The
que estimula la
work
melatonina, que es la hormona
mechanism is that it
los cuerpos de
stimulates
manera natural,
melatonin, which is
natural
a
producen.
hormone that
Cuando
in
el
a
sol se
natural way
está
your body produces
ocultando,
once the sun
ahí
goes down.
el cuerpo estimula la
And that's
melatonina
when
para
your
que la
body
noche no se
stimulates
torne
melatonin, so
turbológica.
at night you
Pero
feel
ya a
sleepy
estas
and you sleep
alturas
well.
hay mucha
But
gente que tiene
already
alteraciones de su
there are many
melatonina
people
y no pueden
currently who are
dormir.
going through
Entonces,
alterations with their
pues aquí lo
melatonin and they
que
can't
nosotros los
sleep.
médicos hacemos,
So what
hay
us
dos
doctors
opciones.
do, there are
Uno,
two
pero muchos
options.
colegas
Not me, but
recetan
many colleagues
benzodiazepínas, clonazepam
prescribe
y todo eso
clonazepam,
para dormir, pero
benzodiazepines
se vuelve
to be
adictivo
able to
y
sleep, but it
tiene efectos
becomes addictive
secundarios.
and it has
Yo,
secondary
antes de conocer
effects.
los parches,
Before
sí
I got to
recetaba
know the patches,
melatonina,
I used to
pero yo
also
veía que con
prescribe
5 miligramos
melatonin, but I saw
dormían
that with
y 10
5
miligramos
milligrams
no
they wouldn't
dormían,
sleep,
con
with 10
15
milligrams they
miligramos no
wouldn't sleep,
dormían. Entonces,
with
como que
10
de repente
milligrams they wouldn't
el
sleep.
medicamento
So
tampoco ayudaba
suddenly the
mucho porque
medication wouldn't
solo
help too
aumentaba
much
cierto
because
porcentaje
it
de
would also
de
increase a certain
melatonina,
percentage
o
of
sea,
the
un 10, un
melatonin, a
20%.
10 or a
Pero
20%.
entonces, cuando conozco estos
But
patches, me
then when
pongo a
I got to know
investigar
these
que no
patches
es
and I started
no es el que tomes la
investigating them,
melatonina,
it's
sino que el
not that
patch
you
te va a
take
estimular que
melatonin,
tu
it's that
cuerpo
the
produzca
patch is going to
melatonina.
stimulate your body to
¡Wow!
produce melatonin.
Impresionante.
And
Yo
wow, it's
normalmente
amazing.
duermo bien,
Normally
pero
I
cuando
sleep
regalaron
well,
estos
but
patches, no sé si se
when they
acuerdan,
gave me
hace
these
unos
patches, I don't
3
know
meses
if you
más o menos,
remember,
me los
around 3 months
regalaron y
ago,
me
more or
los
less,
probaron.
I
Es
said, I'm going to try
impresionante
them.
cómo
And it
en 2
is
segundos
amazing
me
how in
bajaron
two
muchísima grasa.
seconds
Estaba la
my
almohada,
head
quedaba
was
yo dormida,
on the
¿no?
pillow and I would
Y
fall
entonces
asleep.
lo recetó para pacientes que tienen insomnio.
So I
Nunca lo
prescribe it
receto
for
solo,
patients who are
siempre
going
con
through
el
insomnia. I
X39.
never
Y si
prescribe it
hay
on my
alguna
own, always with
enfermedad,
X39. And if
me
there
gusta
is
mejor
any illness, I
dormirme.
recommend it with
X39 además
Eon
se
at
llama
night,
Silent Night,
X39, Eon, and Silent
duermes
Nights.
pero como bebé.
And you
En la
sleep
noche
like
te
a
pegas
baby.
Ion y
At
Silent Night
night,
y en el
use
día te
Eon
pegas
and
el
Silent Night, and
X39.
during the day,
Personas con
X39.
insomnio
And
hasta que
people with
tomen un
insomnia,
medicamento
until
fuerte,
they take a
les va
strong
espectacular.
medication,
Ahora, si estás en
it's
los Estados Unidos,
spectacular.
tienes
Now,
a
if
la
you're in
vida,
the
que es
US,
otro
you have
Style,
A La Vida.
también te
We're
ayuda a
going to
dormir
speak about that
muchísimo.
too. It
Entonces, lo
helps
que
you
hace el
sleep
Silent
really
Night es
well.
eso, a
So
través de
what Silent Night
la
does
melatonina te
is this. It
regula
activates your
y te
melatonin
ayuda a
and
relajarte, a
it
llegar
helps you
a un
regulate
sueño
your
más profundo.
circadian cycle
Este
and
se usa
have a
exclusivamente de
deeper
noche
sleep. You use this
durante 12 horas
exclusively at
todos
night
los días
during 12
y lo puedes
hours
usar
every
en
day.
la
And you
frente
can use it here
o
on your
atrás,
forehead
acá en la sien del
or
lado
here
derecho o
on
debajo
the
de la
right side of
oreja
your
del lado
temple or
derecho.
underneath your
Exacto, exacto,
right
Karen.
ear.
Ahí, ahí.
Exactly,
De este lado
exactly,
acá atrás.
Karen. There on the back.
En la parte superior del pecho también,
On
un
the
poquito, ¿sale?
on
Se
the
puede
high
combinar, les
chest
decía, con
too. You can
X39
combine it
Ion
with
y les va
X39
increíble,
ion
¿sale?
and
Cuando
it's
de plano
amazing.
tengan
When
clientes que no
you
pueden
have
dormir, pero
customers who can't sleep
insomnio
well
crónico de
because they
hace
have chronic
muchísimos años y que
insomnia
han
from
probado de
many
todo,
years ago who have tried
denles
a lot of
estos tres
things,
parches y
give
van a
them these
dormir
three
como
patches
bebés.
and they're going to be able
Ok,
to sleep like babies.
el Ice Wave es el único
Okay,
patch, como les
Ice
decía al
Wave is the
principio, que
only
va a
patch, like I
bloquear.
said at the
Todos
beginning, that
los
is
demás
going to block.
activan, son
All the rest of
activadores
them
de algo, ¿no?
activate.
Por
They
ejemplo, el Silent
activate
Night activa
something. Like
melatonina,
Silent Nights
el
activates
X39
melatonin.
activa
X39
el péptido de cobre
activates copper
THK.
peptide
Todos
THK.
activan algo.
All of them
El Ice
activate
Wave es el único
something,
que
but Ice Wave
bloquea,
is the only one
¿ok?
that blocks. Okay? What is it going to
impulsos
block?
energéticos del
The
sistema nervioso
energetic
relacionados al
nervous
dolor.
system
Entonces, lo
impulse
que hace es
related with
canalizar
pain.
rápido y
So what it
efectivamente el
does
dolor
is
por medio
alleviate
de algunos
fast and
fármacos
effectively
de manera
physical pain,
natural
obviously without
y
medications
se
in
le
a
conoce como
natural
un
way, and it's
analgésico
known as
analgésico.
a
Y
natural
entonces también funciona
analgesic.
para dolores
And it
crónicos
also
o
works
dolores
for chronic
agudos.
pain
Este
or
sí, por ejemplo,
acute
puede
pain.
controlar una
You can
migraña, a lo
control a
mejor
migraine with this,
dolor
or
después de una
if
cirugía,
you had a surgery or
dolor
you
de
hit yourself,
ciática,
a
dolor de
sciatica
cualquier tipo de
pain,
dolor que
any kind of pain that you might have. This ice wave takes that pain away, but it is amazing how it happens in seconds. Yesterday, 3 days ago, my mom twisted her ankle and she said, "Oh, I have this pain on this side of the body." And I told her, "You have ice wave there, use it." And it's true. In this moment, I helped her use it. I put the brown one where she had the pain and the white one at a side. I didn't even count till 3 when my mom said, "Yes, the pain has gone away." And right now she's walking and doing her things. It is amazing how this acts in seconds. This ice wave has 30 patches, 15 white and 15 brown. And look, you have to use both patches at the same time every day when you have pain. So it also decreases local inflammation a bit. If you hit yourself and you are going purple, you use LifeWave and the pain goes away faster. So it works via non-invasive neuromodulation. Remember that none of our patches is invasive. Now, sorry, here it says white and blue, but it's white and brown. You use it for 12 hours and you rest for 12 hours. I prefer for people to use them when they are awake because they're active. And there's 2 ways of putting them on. For example, if you have fibromyalgia, sclerosis, arthritis, which are pains in your whole body, you can put them on here at your shoulder level, on the back, the brown one and the right one on that side, or in the soles of your feet, brown on one side or white on the other when you have a general pain. When you have a pain, for example, on your sciatica, on your hip, you can put it on that area on the lower back, and the same brown on the left and white on the right. But when you have a very localized pain, as my mom said, I have pain here. Okay, let me know where. If you have pain here on the center of your hand, there where you have the pain, you can patch in brown and white. You can rotate on the side of the clock.
Y cuentas 3 segundos y analizas, pues sí me bajó, pero la mitad. Ahora lo cambias a las 3, lo pones a las 3 en las manecillas del reloj. Pues ya me bajó 3/4. Ahora lo cambias a las 6, aquí abajito. Ahora ya se me quitó el dolor y ahí te lo dejas y en esa localización te lo vas a pegar todos los días, ¿ok? O sea, tú lo vas rolando en las manecillas del reloj hasta lograr que se quite el dolor. El penúltimo parche es el Energy Enhancer, también es muy buen parche, pues su nombre lo dice, te ayuda a aumentar tus niveles de energía, de resistencia física y de oxigenación celular. Este es más común como para atletas, militares, personas que tienen que estar muy activas, pero muy, muy, muy activas. ¿Por qué? Porque el X39 en sí te da energía, pero si a pesar de que estás usando el X39 y dices, sí, ya me dio energía, pero quiero más, ahí es donde aumentas el Energy Enhancer. También, igual que el Ice Wave, vienen 30 parches, 15 blancos y 15 marrones. Y lo mismo, el parche marrón se pone siempre del lado izquierdo y el parche blanco siempre del lado derecho.
Dime, perdón que me interrumpa, I'm sorry. Carmen, because vamos a empezar otra llamada en otro Zoom y la intérprete se va a tener que ir. So, the interpreter, puedes ir a la otra llamada, no te preocupes, ¿oíste, Carmen? So, sorry. ¿Cuánto tiempo te falta, Jime?
5 minutos.
Ok, perfecto, listo. So, la intérprete que puede salir ahora, porque ya
sí,
Jay está en otro lado. Dale, gracias, Jime, sorry.
Sí, ya en 5 minutos terminamos. Es que son tantos parches y tengo tanto que decir que me estoy yendo muy rápido. El Energy Enhancer, la manera en la que nos da energía es porque estimula la beta oxidación de los ácidos grasos, o sea, como que queman los ácidos grasos, utiliza la grasa para producir energía y entonces también ayuda a bajar de peso cuando haces ejercicio, ¿ok? Se usan los dos parches al mismo tiempo, acuérdense, diario por 12 horas. Y aquí te lo puedes poner, por ejemplo, a nivel pulmonar, del lado izquierdo